يعطيكم العافية شباب. اليوم بدنا نحكي عن الفيميل reproductive system. نحكي بداية عن الفيميل reproductive functions، وهاي الفانكشنز include first preparation of the female body for consumption and pregnancy, second the period of pregnancy itself. السلايد اللي امامنا بيورجينا الاناتومي of the female sexual organs، واللي هم include the ovaries, fallopian tubes واليوترس إضافة إلى الفاجينا. Reproduction begins with the development of ova in the ovaries. In the middle of each monthly sexual cycle, a single ovum is expelled from an ovarian follicle into the abdominal cavity. This ovum then passes through one of the fallopian tubes into the uterus. If it has been fertilized by a sperm, it implants in the uterus, where it develops into a fetus, a placenta, and fetal membranes. During fetal life, the outer surface of the ovary is covered by a germinal epithelial cells. As the female fetus develops, primordial ova differentiate from this germinal epithelium and migrate into the substance of the ovarian cortex. Each ovum then collects around it a layer of spindle cells from the ovarian stroma and causes them to take on epithelioid characteristics. They are then called granulosa cells. The ovum surrounded by a single layer of granulosa cells is called the primordial follicle. The ovum at this stage is still immature, requiring 2 more cell divisions before it can be fertilized by a sperm. At this time, the ovum is called a primary oocyte. During all the reproductive years of adult female life, between about 13 to 46 years of age, 400 to 500 of the primordial follicles develop enough to expel their ova, 1 each month. At the end of reproductive capability, at menopause, only a few primordial follicles remain in the ovaries, and even these degenerate soon after that. Female hormonal system includes 3 levels of hormones. First, gonadotropin-releasing hormone, which is secreted by the hypothalamus. Second, FSH and LH, which are secreted by the anterior pituitary. Third, estrogen and progesterone, which are secreted by the ovaries. Growth hormone, gonadotropin-releasing hormone, release pulsatile once every 90 minutes, increases and decreases much less drastically during the monthly sexual cycle. Female monthly sexual cycle means monthly rhythmical changes in the rates of secretion of the female sex hormones and corresponding physical changes in the ovaries, uterus, and other sexual organs. The duration of the cycle averaged 28 days، ممكن تكون 20 إلى 45 days. Abnormal cycle length is frequently associated with decreased fertility. There are two significant results of the female sexual cycle. First, only a single ovum is normally released from the ovaries each month. Second, the uterine endometrium is prepared in advance for implantation of the fertilized ovum at the required time of the month. Effects of LH and FSH on the ovaries. The ovarian changes that occur during sexual cycle depend completely on the gonadotropic releasing hormone, FSH and LH, which are secreted by the anterior pituitary gland. They stimulate the ovarian target cells to increase their rates of secretion, growth, and proliferation. In the absence of these hormones, LH and FSH, the ovaries remain inactive. During childhood, almost no pituitary gonadotropic hormones are secreted, which means the ovaries remain inactive. At puberty, which is almost between 9 to 12 years of age, anterior pituitary gland start to secrete FSH and LH, leading to the beginning of monthly sexual cycle. First menstrual cycle is called menarche. During each month of the female sexual cycle, a cyclical increase and decrease of both FSH and LH. These cyclical variations cause cyclical ovarian changes. FSH and LH stimulate their ovarian target cells by combining with highly specific FSH and LH receptors in the ovarian target cell membranes. The activated receptors increase the cell's rates of secretion and usually the growth and proliferation of the cells. Almost all these stimulatory effects result from activation of the cyclic AMP second messenger system in the cell cytoplasm. Causes the formation of protein kinase and multiple phosphorylations of key enzymes that stimulate sex hormone synthesis. Ovarian cycle phases include three phases. First, follicular phase. Second, ovulation. Third, luteal phase. Ovarian follicle growth, follicular phase. When a female child is born, each ovum is surrounded by a single layer of granulosa cells, what we call it primordial follicles. Throughout childhood, the granulosa cells provide nourishment for the ovum and secrete an oocyte maturation inhibiting factor that keeps the ovum suspended in its primordial state and prophase stage of meiotic division. After puberty, anterior pituitary secretes FSH and LH, which stimulate the ovaries with some follicles to grow. The first stage of follicular growth is moderate enlargement of ovum itself, then enlargement of the ovum to increase in size and growth of additional layers of granulosa cells of some follicles, what we call it primary follicles. Development of secondary follicles. During the first few days of the monthly sexual cycle, there is increased secretion of FSH and LH. slightly greater and earlier increase of FSH, and preceding it by a few days. This causes accelerated growth of 6 to 12 primary follicles each month. The initial effect is a rapid proliferation of granulosa cells, giving rise to many more layers of these cells. Spindle cells derived from the ovary stroma collect in several layers outside the granulosa cells, giving rise to a second mass of cells called the theca layers. Theca layer is divided into two layers: theca interna epithelioid characteristics similar to granulosa cells and secrete sex hormone estrogen and progesterone. Theca externa, the outer layer, develops into a highly vascular connective tissue capsule that becomes the capsule of the developing follicle. Development of antral and vascular follicles. Few days after proliferation and growth of the follicles, the granulosa cells secretes follicular fluids containing high concentration of estrogen. This fluid accumulates to form antrum, to appear within the mass of the granulosa cells. The early growth of the follicle up to the antral stage is under FSH stimulation alone. Then there is accelerated growth of one of the follicles into larger follicles called vascular follicle, caused by estrogen, into a follicle caused the granulosa cells to increase FSH receptors. Second, both estrogen and FSH promote LH receptors on the granulosa cells, leading to more increase in follicular secretion. Once the antral follicles begin to grow, their growth occurs explosively. The ovum itself also enlarges 3 to 4 times, giving a total ovum diameters increase up to 10 folds. As the follicle enlarges, the ovum remains embedded in a mass of granulosa cells located at one pole of the follicle. Follicle atresia. During the first 11 to 12 days of this follicular growth, the rate of secretion of FSH and LH decreases slightly because of the negative feedback effect of estrogen on the anterior pituitary gland. All follicles except one involute atresia. The single follicle reaches a diameter of 1 to 1.5 centimeters at the time of ovulation and is called the mature follicle. Importance of the atresia: preventing more than one child from developing with each pregnancy. Second phase, ovulation. Ovulation in a normal 28-day sexual cycle occurs on day 14 after the onset of menstruation. Before ovulation, the protruding outer wall of the follicle swells rapidly. Small area in the center of the follicle called stigma protrude and fluids ooze from the follicle, and the stigma then ruptures, allowing more viscous fluid to evaginate outward, carrying with it the ovum, surrounded by mass of several thousands of granulosa cells called corona radiata. Ovulation. LH surge is necessary for ovulation. 2 days before ovulation, the rate of LH secretion from the anterior pituitary increases markedly to 6 to 10 folds and peak about 16 hours before ovulation. FSH also increases to 2 to 3-fold and acts synergistically with LH to cause rapid swelling of the follicle before ovulation. LH has specific effect on the granulosa cells and theca cells, converting them to progesterone secreting cells, so the rate of estrogen secretion begins to fall about 1 day before ovulation, while progesterone secretion begins to increase. In this environment, rapid growth of the follicle, diminishing estrogen secretion after prolonged phase of excessive estrogen secretion, initiation of secretion of progesterone that cause ovulation. Note, without the initial pre-ovulatory surge of LH, ovulation will not take place. Methods to determine occurrence of ovulation: progesterone test to analyze the urine for a surge in pregnandiole, the end products of progesterone metabolism during the later half of the sexual cycle. Second, charting body temperature throughout the cycle. Secretion of progesterone during the later half of the cycle raises the body temperature about 0.5 Fahrenheit, with the temperature rise coming abruptly at the time of ovulation. Corpus luteum, luteal phase, luteinization. After expulsion of the ovum from the follicle, the remaining granulosa and theca interna cells become lutein cells, collectively called corpus luteum. Cells enlarged in diameter 2 or more times become filled with lipid inclusions, yellowish appearance. Well-developed vascular supply grows into the corpus luteum. Granulosa cells in the corpus luteum produce female sex hormone progesterone and estrogen. Theca cells in the corpus luteum produce mainly the androgens, androstenedione and testosterone. Most of these hormones are converted by granulosa cells into estrogen by the enzyme aromatase. If fertilization does not occur, corpus luteum begins to involute and eventually loses its secretory function and its yellowish lipid characteristics about 12 days after ovulation, becoming the corpus albicanus. Few weeks later, corpus albicanus is replaced by connective tissue and over months is absorbed. Involution of the corpus luteum and onset of the next ovarian cycle. Low levels of both FSH and LH, eventually loss of this hormone causes the corpus luteum to degenerate completely. Process of involution of the corpus luteum, 12 days of corpus luteum life. Estrogen and progesterone secreted by the corpus luteum in luteal phase have strong negative feedback effect on anterior pituitary to inhibit the secretion of FSH and LH. Second, lutein cells secrete small amounts of inhibin, which inhibit secretion of FSH by anterior pituitary gland. About 26 days of normal sexual cycle and after involution of corpus luteum, sudden cessation of secretion of estrogen, progesterone, and inhibin leads to removes the feedback inhibition of anterior pituitary and allowing increased secretion of FSH and LH again, which initiates the growth of new follicles, beginning a new ovarian cycle. هذا السلايد اللي أمامنا بورجينا اللي هو different stages للfollicular development في الأوفري. Summary: about every 28 days, gonadotropic hormones from the anterior pituitary gland cause about 8 to 12 new follicles to begin to grow in the ovaries. One of these follicles finally become mature and ovulates on the 14th day of the cycle. During growth of the follicles, mainly estrogen is secreted. After ovulation, the secretory cells of the ovulating follicles develop into corpus luteum that secretes large quantities of both major female sex hormones, progesterone and estrogen. After another 2 weeks, the corpus luteum degenerates. The ovarian hormones, estrogen and progesterone decrease greatly and menstruation begins. A new ovarian cycle then follows. هيك نكون خلصنا الجزء الأول ومنكمل في الجزء الثاني second part. شكرا.